Hello, everybody, and welcome again. It's Craig Keegan here, and with a special guest, Joanne Villani from PreVu Software. The reason why Joanne is here today is because we have had such a great catch up previously, and I've asked her back to come on and tell us all about her software, how it works, how you can gain access to this, and how you can make some money out of this from a dental practice perspective. So this is slightly different to most of the other podcasts that we have done. This is going to show you how to make some money. That's what we want to do today. Welcome, Joanne.
Hi, Craig. Thanks for having me.
You are most welcome. Now, you just said, I don't know how this is going to go. Let's just get on and do it. Well, that's exactly what we're going to do. We're not going to waste any time here. We want to add value straight away to people. So tell me about PreVu. What is it and how can people gain access to it? How can people use it? How can our practice managers out there make money for their practices?
My God, there's so many questions, so many answers there.
Well, let's just go one by one. What is PreVu?
So what PreVu is, it's a smile simulation software. So any member of the dental team can create a smile simulation. So we're really known for fast, natural looking simulations, and our purpose is to increase case acceptance. So our goal is to help more patients have smiles that they love. And sometimes it's a little tricky for the dentist and the team to have those conversations. So if we can show patients what's possible through visuals and a personalized dental treatment plan where they can see visually how transformative it can be to have an enhanced smile, it really can create a dramatic response in the patient, and also in terms of case acceptance, get more people interested in treatment. Or sometimes they know they need treatment, but it might be costly to actually have it. But there's an amazing aesthetic benefit that goes along with bringing a patient back to health and function. We get them to understand that along with all of that, there's that aesthetic benefit, and they focus more on the outcomes versus the cost.
I think that's what got me when we spoke last time, just chatting amongst ourselves. You pulled it up and you showed me a demo, and it was just so easy to do. But I noticed when you're doing your little speech there, I can actually see myself on the left-hand side of the screen. And there I was with my mouth shut. That's a telltale. That tells a story, doesn't it?
So we really feel like you can tell a lot about a person by their smile. And people judge us on things like whether we smile or not. So the way that we feel in terms of our confidence really kind of shines through to other people, and they may make judgments on us. Are we nice people? Are we not nice people? So when you look at actually in terms of how important a smile is, so like why should we really be focused? Is it vanity? Is it that we think everyone should have a Hollywood smile? It's not that. It's just that it's the first part of a first impression. It is what makes people kind of look across the room and know if you're engaged or not. We know that people who are smiling are perceived as more trustworthy, more approachable, and in many times in a professional aspect, they are more promotable. And we certainly know from a personal level that the number one thing that people look at when they're looking for love and someone that they want to date is their smile. And if you are not smiling when you meet someone, you may not have that connection. And someone who could be ultimately a really important person in your life, that connection just goes by and it never happens. So we feel like in terms of just having people feel better about themselves, have higher self-esteem, have more confidence to go out in the world and kind of do the things that they want to do, a smile is really impactful. So we think it's equally as important to be addressed as health and function. We want to keep people out of pain. We want to keep them healthy, but we also want to give them a smile that makes them feel good, whether it's just simply a whiter, brighter smile, a straighter smile, restoring their smile to whatever degree from small to full mouth reconstruction. We want to show people what's possible so they're more interested to get that treatment.
Okay, so let's get real here. This is not the only software out there that does smiles. Why PreVu? What is so special about PreVu?
Yeah, you don't even need anything dental specific to do something like this. If you can do Photoshop, you can absolutely do Photoshop. The reason that behind PreVu is that it's fast, it's easy, and it's really natural looking. So what that means is any member of the team can do it. You can add it on a whim to any appointment because we have people who are interested in improving their smile, but we have many more people who don't know they're interested. And they're not going to come back for in-mouth trial smiles if they're not interested. They're not going to invest in physical wax-ups to kind of show them on a model what they would look like. So we want to sort of strike when the iron's hot. So with PreVu, fast, easy, you can do it in seconds, have it up on the screen, really use it as a visual in terms of having a conversation. Any simulation software will give you a simulation, and sort of it depends on what a office's goal is. So what is the goal of the practice? Do we want to have a tool where we can engage patients, where we can have better, more effective discussions, where we can show them what's possible? If that's the case, PreVu is an amazing fit. Where we're not a good fit is sort of if an office is looking for a treatment planning software. We want to design the smile. We want to see exactly what shape the teeth will be, what width, what length, how are they going to fit together. That is something that it also can give you a simulation, but it's not practical to use all the time. You're really going to use it when someone says yes, they want to move forward. They don't look as natural. They take more time to do. And you will use that type of software in the next step should the patient say yes. So we have a bit of a different philosophy. We don't think that an office needs to spend the time, money, and resources to work up a case when the case doesn't really exist yet.
So
right?
You're selling the sizzle rather
Yeah.
than the technique. So you're not doing the clinical side of it. You're actually just selling the sizzle, putting the concept into the person's mind and allowing them to emotionalize it.
Yeah.
Is that a fair
Yeah.
observation?
Yeah, because the first step in getting the yes is the recognition of the patient that they have a want or the need. Nobody pays to fix problems that they don't think they have. And they may also really not think they're interested in improving their smile. They may think I'm not that vain or I don't have the money for that. And they've got their own feelings about it. We can show them really quickly. And if with a little bit of education, we can help them to see my teeth are worn down. I didn't realize that. They don't know that this damage has happened over years. Wow, that tooth that's missing, it's in my smile line. I didn't realize it. I thought it was really far back. Wow, I didn't even realize my teeth were crooked. I think my teeth look fine. But when we show them the simulation is a real reality check. It's a reference photo that side by side, they look back and forth, they go, oh, I have an issue. And when the patient actually recognizes that, they are much more open to having a conversation where ultimately they may end up getting treatment. So yes, it's a sizzle in terms of that emotional connection, that wow, but at least where a lot of our practices in the US, it's not inexpensive to get elective treatment done. So people have to really, really want it. And we know from a buying decision-making process that emotional connection, people don't spend their money logically. They make those decisions based on emotion. And so when we can show someone how transformative it is to their face to have whiter teeth, straighter teeth, nicer teeth, they really want it. They get that emotional connection, and that's where they say, you know what? I'm going to find the resources, the time, the money. I want that, and I'm going to make it happen. reason behind it. There are some systems where the patient does it themselves, and I hate to use the word gimmicky, but I want to use that word because it takes something that is so powerful and so elicits so much emotion that when people actually see these simulations, they get teary-eyed. Sometimes they cry. And that emotion, we want that to happen in the dental practice because being that it's expensive, it's an investment. Sometimes it's scary. People don't want to make the wrong decision. They're not sure. We want to see that emotion in them because there's going to be some objections. And if we know how powerful this has hit them, we can actually use that to overcome those objections, to get people to realize that this is really what they want and help them move forward with treatment. So we really believe that these pictures should be used in a new patient exam, educating people on what issues they have. In a recare appointment where they're coming every 3, 4, 6 months, and maybe we want to re-engage them in terms of talking about treatment they haven't accepted yet. Maybe things are purely cosmetic and the team did not feel comfortable at a certain point talking about purely cosmetic things. Nobody wants to offend their patients. Nobody wants to feel like they're selling to their patients. So what we do at PreVu is we actually include a coaching component where it's not just about the picture. It's about taking this picture, understanding the many use cases that you can use this picture for, new patients, recare, high value consults, and what should you say when you are presenting it? Where does it fit in your workflow? If you haven't taken photos before, we're going to build it into a process for you. A lot of doctors invest in technology that never gets used because it doesn't get put into the workflow. So what we do, and you asked why PreVu, is we have the software which is fast, easy, they look amazing, but we also, since 2016, we've been doing this a long time, we've evolved as a company and now we have sort of what we call as a proven process for actually incorporating these things. So we think that these are so powerful, it's not the best use of them to just let the patient to their own devices when they do them. Even if we do things like virtual consults, and even if we want some engagement where we encourage the patients to send in the photo, if and when it's at all possible, sometimes it's travel time. Some offices are trying to market and get people on a plane to come to their particular office. If that's the case in a virtual consult, of course we would say send the simulation. But when at all possible, in terms of geography, the idea is to use these as tools. Get the patient in the practice, build rapport, build a relationship, introduce them to your team, let them see your office, that you're modern, that you have a compassionate team, that you care, that you do this type of dentistry. It's all getting to the yes. So it's a tool, it's a powerful tool, and it should be used ideally in the office.
Okay, message clear. It's not a gimmick.
Okay.
This is a serious revenue source that needs to be taken seriously and treated correctly. Now, I love the fact that you said that you've got a coaching program for this as well. So if you've got a coaching program, then you've been, in 2016, you've been measuring results for a while now as well. So you would have a bit of an idea now as to how much this is increasing business revenue as well, I suspect.
So in US dollars, I would say that we've worked with offices that have increased their revenue by 7 figures. It's really powerful. We work with offices that are using this as they market for really high value cases like, implant retained dentures, which in the US is about, on average, $25,000 an arch. Full mouth, $50,000. People who are doing full mouth reconstruction, that can be even higher, $70,000, $80,000. So from a perspective of just getting one case, it can be significant. As a matter of fact, when we work with practices who combine the software with our system, we tell them, if you just in phase 1 of our system, which is like learn the software using real patients and, choose this type of patient and say what we tell you to say, we want you to generate, 3 to 10 times minimum what you pay us for an entire year.
Wow.
So, each office is a little bit different. It is challenging. A lot of offices don't accurately track their own case acceptance. And a lot of offices think that their case acceptance is a lot higher than it actually is. Or Their case acceptance of the lower value treatment plans is pretty high, but the higher value treatment plans, the higher the cost, the lower the case acceptance. But if you look at the statistics, they'll say that 50% of people don't move forward with treatment. In the US, the average dental practice is losing about $500,000 every year in unaccepted treatment. If you look at the research in the US from the American Academy of Cosmetic Dentistry, they say simply by ignoring cosmetic conversations or opportunities because you don't want to sell or don't want to offend, hurting your revenue in the terms of you can increase it 15 to 30% just by having more conversations. So the thing with this is a lot of doctors don't feel the pain because they don't understand the amount of money they're leaving on the table. They think they're doing good. Their chair is filled. They're working their buns off, doing lots of little procedures, and we kind of see it a little bit differently. We can have a team that's less stressed. You can see less patients if you just have the right conversations and help people to have smiles that they love. Those treatments tend to be more profitable and allow you to see less patients.
Well, Joanne, I wish I hadn't have worn a white shirt today because you were just driving a knife through my heart when you were talking there about the way those businesses are being run. The shirt's going to be all bloodied now.
Oh, no.
So what I need you to do is after this, you need to write down all of those businesses that you were talking about, send them over to me, and we're going to get them on our mastermind session and fix them all up, okay?
There's just so many offices that are not tracking what they're doing and they don't know what they're leaving on the table. And then the opposite side of it, a lot of them are insurance based and they don't think the compensation is right, but a lot of dentists don't realize that they are more in control of their revenue because from our standpoint, there's a huge aesthetic boom, at least in the US. Women are getting facelifts earlier than ever. They're getting facelifts, they're traveling for hair transplants, and cosmetic dentistry is the smile side of the aesthetic boom, and that is profitable fee for service. And if the offices are comfortable doing those procedures and want to do more of them, that's why they come to PreVu and we work with them and their team.
Well, that answered pretty much all of the questions I asked you at the beginning, didn't it? That's what PreVu is about. Yeah, it is very disturbing that these practices aren't keeping track of their numbers. Right. One of my favourite sayings has always been, without reliable data, you're merely another person with an opinion.
You don't know what's going on in your practice to any real reliability, and you sometimes have a different impression than it actually is.
Correct.
Yeah.
Without monitoring those stats, those numbers, you don't know what reality is.
Yeah. And sometimes they don't really know almost sometimes what to look for. We worked with one practice where they thought their treatment coordinator was just a rock star. And this happened to be a full arch practice and they specialized in denture, overdenture, and implant retained denture. And they said that their treatment coordinator, she has a 96% case acceptance rate, but of the lowest possible option. And to me, that's not success.
No. I was dealing with a pricing strategist earlier this year, in actual fact, and he said, increase your prices by 40%. He said, do that today. What? 40%? But I'll lose all my customers. Or no, you're going to lose half your customers by increasing your price by 40% today. You'll lose half your customers, which means you've got half your time free now to put in higher quality customers with higher profit margins. Now, obviously, in a health environment, that may not be ideal because you're there for the care side of things. But the strategy, the logic of people's fear that if they increase prices, that if they don't get that if they do the minimum and they only get the minimum profit, you've got to be able to go for those higher values. It is better because you will make more profit out of them.
Yeah. And we really feel like it's a win-win. That offering your patients a higher level of care, which in turn does cost them more money, is going to give them a beautiful, healthy smile that they can be really proud about and love. And at the same time, it's going to help with the practice revenue. So I always feel just by doing right for the patient is really going to be what's going to help the practice grow. Just watching and waiting in tooth by tooth dentistry, which doesn't look at the whole picture, or not talking to people about aesthetics when they would really benefit from it isn't helping your practice. Sometimes people feel that way because if I'm going to offer something and I think it's expensive, I feel uncomfortable because I'm focused on what I'm getting from it. But if dental professionals really believe that a beautiful smile really is life-changing for a person, we should focus on what they are getting from it. More confidence, more self-esteem, meeting the love of their life, getting that job that they want. That's priceless. And if we can offer that to a patient, it's going to cost money. And it's okay that the doctor make money doing it, but it's a win-win for both.
It is. I was doing an interview a few days ago, and it was on an interesting topic. I won't actually go on the topic because it was not suitable for this forum. But the person was talking about they needed more clients. And we got down chatting about lead generations and then funnels and all this sort of stuff. And the person that I was talking to, who was in a health industry, they kept on focusing on themselves when they were talking about this. I said, no. I said, you're talking about yourself here again. I said, I want you to be focused on the customer. I want you to be focused on how did you come into their world? What sparked their interest? I said, you need to tag them on that. I said, then you need to query them, survey them. I don't mean grill them. I just mean ask them a question. What are they interested in, this or this? I said, then take them down a different branch. You need to get to know your client and give them what they need to make them better, to inspire them all the way through. It just totally changed the way that he's going to be doing business now. Those few words on, don't focus on your own lead generation, focus on what the client is looking for, what the client wants, what the client needs and is passionate about, and keep giving them that.
And I'm going to take that from a different perspective in dentistry too, because when patients come in and they know they're interested in improving their smile, a lot of offices have intake forms, so they think that they're getting what the patient really wants because they ask the questions, but they take those questions at surface level. And if a patient says, yes, I'm interested, there are some things I would change about my smile, great, let's talk about that. Where a lot of doctors miss the opportunity is to say, I'm the professional, I know how I can help them, I don't think they're aware. So if I think I can help them, I'm going to take that information they gave me as sort of a baseline, but then I'm going to have an approach because I want to introduce to them things I don't even think that are on their radar that I as a professional think that they would love. And I'm going to bring that up too. So we sort of use that logic of, it's like, if this, then that. So if this is they're interested, we're going to do a preview and we're going to show them a smile makeover and they're interested and we're going to show them what's possible. But if they're not interested, we're going to still show them the preview. If in our office we've determined that specific clinical presentations exist, that we will use that picture to help educate the patient about it and inspire their interest. So we kind of look at it from both ways.
Joanne, you've been listening in on my personal conversations, I can tell that. So
that or I've been working too long with dentists.
Just between you and I, and we'll just, not everybody else here, when I deal with a practice, because as you know, I do roll-ups of practices. When I deal with a practice, I send them 5 forms. And if anybody wants the 5 forms, let me know and I'll give them to you as well. But in one of the forms, it asks them, what's your biggest problem? What's your second biggest problem? Your third biggest problem? And I was saying to someone just yesterday, I asked them these questions. I said, what they're going to put in there is wrong. I said, I know that. I said, because my job as a professional in going into these businesses and troubleshooting these businesses is that I have the experience, I know what the answers are. But if you don't ask people the question, they don't feel valued. So you have to ask them the question. Even if you know whatever they put in there, okay, fine. That's their perspective. But if they knew the right answer, it would have been fixed already. But because of my experience, I'm the one that has to go in and fill that out later on the side after I've spoken with them.
So we say we have to meet people where they are and bring them where we need them to be, even if sometimes they don't know that's the direction they need to go in.
Yes, but isn't that exactly what you just said earlier? You
Yeah,
take them
that's
on the
what we
same
do every
thing.
day.
I just do it from a business side of things because I don't have the
Yeah.
clinical knowledge or experience to do it there.
We do help so many dentists, and sometimes we just have to get them out of their own head because they have certain beliefs or things they think they already do, but we just have to kind of get them to look from a different perspective. And it's all about helping the patient, and they do benefit from it. But when we look at just, the ultimate patient care, the end result that will follow is growth in a practice, more success in a practice, a team that's happier, maybe they're well trained, a team that will stay longer, people who are enjoying their day at work a little bit more because we're really helping patients, more patients at a different level that's fun and amazing, and not just always dentistry is really tough. Dentists are constantly working with people that are in pain or coming in the office. I don't know how many times a day they hear from patients, I hate being here. I don't like the dentist. That's hard, but there's such another way to, and you can't not have that. And you will always have that, but you can add so much more joy and help than just positivity from really kind of opening up the practices to sort of this other way of practicing where we sort of look at all this and we just want people to live happy lives and have amazing smiles, you know?
And if you're adding seven figures to the bottom line, you're going to have a hell of a Christmas party with that, aren't you?
Sometimes I feel like doctors are so caught up in what they do and they work hard and they're like, I make enough. I meet, some of them don't meet their goals and they're not really striving for it, but it's a hard day. So it's like, listen, I'm doing what I'm doing and I sort of have this idea of what I should do and they're not looking above it. And there are, of course, dental entrepreneurs out there that are really doing really, really well in multiple practices and so on. You know all about that. But sometimes dentists just get in a rut. And I did actually speak to a dentist. He's like, I'm working my butt off doing 1,500, of these things where I could, have done a aesthetic case. And this particular dentist, he actually knew 3 of his patients the week before I talked to him had gotten veneers done in another practice because they didn't know his practice did them. And it was
Ouch.
like crushing to him, you know? So
Ouch.
yeah. And it's fun to show people their new smiles. People love it. It's just a different approach, right? We should do a little bit of all of that every day.
We should. Joanne, thank you so much for coming on board and doing this. When we spoke and what you showed me in the demonstration, there's a very quick demonstration, it really just made it simple. And then to hear today, that simplicity can add 7 figures to your bottom line. People had better watch this show because they're missing out. And all your details will be at the end of this, as it always is. My understanding is that you are looking to do some business here in Australia and other places around the world as well. Please tell us a bit about that as well.
We would love to. We certainly have international clients that are using our software, but we've been mostly focused on the US market. And we would love to meet with companies that can help introduce PreVu to dental practices all around the world and help more patients love their smiles. So we would welcome any company that would be interested in working with us to reach out to us and have a discussion about that.
Well, sounds good. Now, just a heads up, you won't be getting any inquiries from South Sydney or from Collingwood in Melbourne in Australia, because there's the old joke about what do you call 100 legs and 2 teeth?
They don't have.
It's the South Sydney rugby league support club.
Okay. No, we can help those rugby players restore their smiles.
You can. Okay.
We can help them.
Thank you so much, Joanne.
Thanks
It
for
has been a
having
pleasure.
me. Yes, it's been a pleasure. Thank you so much.